Thank you, Marianne, for that really beautiful introduction. And it really is great for me to be in a room full of mostly women, women dedicated to bringing children into this world in the most loving way possible. Ina May Gaskin, who I'm sure most of you know well, said this: "Remember this, for it is as true gets. Your body is not a lemon. You are not a machine. The Creator is not a careless mechanic. Human female bodies have the same potential to give birth well as do aardvarks, lions, rhinoceri, elephants, moose, and water buffalo. Even if it had not been your habit throughout your life so far, I recommend that you learn to think positively about your body." And then she said, "There is no other organ quite like the uterus. If men had such an organ, they would brag about it. So should we." In 1958, which was the year of my birth, there was a very popular journal in the United States known as the Ladies' Home Journal, which for the first time exposed the shocking abuse of women in labor. It caused a great commotion at the time, but the issue, like many other horrendous disgraces, such as the sexual abuse and rape of children, the issue got swept under the carpet. I remember the first delivery I attended as a fourth-year student, shivering with fear and excitement, and it was a jamboree of midwives shouting at a young woman, trying as hard as she could to push out her baby, midwives jumping all over her, slapping her, pushing her on the fundus of her uterus, and accusing her of wanting to kill her baby. I was completely shattered. Switch the clock to Saturday night last week, and in 2015, and this is what a student described and put under my door this morning. "I spoke to a 20-year-old young woman who was in labor with her first child. She was having strong contractions and screaming. She had no companion, and the nurses were ignoring her or telling her to shut up as she was disturbing the labor ward. She was 6 centimeters dilated and due for assessment in 2 hours. Next thing, she was found lying on the floor outside the toilet, saying that she thought she needed to defecate, but now she thought the baby was coming. The student helped her back, this is a 20-year-old student, helped her back to the bed, and then the sisters arrived and began shouting at her, accusing her of wanting to kill her baby. No one gave you permission to the toilet. How dare you stand up? You can now deliver on your own. They then left the cubicle, and as they did so, the patient delivered her baby who dropped on the floor. So the student says to me, I picked up the baby and helped the mother on the bed and put the baby on the mother's chest, and the sisters left me alone to clamp the cord and deliver the placenta. Throughout the entire incident, the patient did not say a word. She just screamed or cried. No one cared, and I felt so completely helpless and unable to protect her. I've read literally hundreds of these student reflections of this vile abuse of women at their most vulnerable in a birthing facility designed for safe motherhood and run by women. There is some pride in the world that the maternal mortality ratio has been reduced by 45% from 1990 to 2013, a guesstimated 523,000 deaths in 1990, 289 deaths in 2013, of which 179 occurred in sub-Saharan Africa. Despite this improvement, the majority of maternal deaths continue to occur in low-income countries, where 50% of women give birth without a trained birth attendant and without access to modern methods of treatment, resuscitation, and care of women with severe birth complications. We live in a world where medicine is so perversely practiced. Like institutions that have 90% caesarean section rates in Cape Town for otherwise healthy women and often without any medical indication, to one in which health inequity and lack of access to care is quite literally a killer. What has the medicalization of medicine done to help women? Has it actually made pregnancy safer? have CTGs, induction of labor, use of synthetic hormones, depriving women of the presence of doulas, and many other interventions actually saved lives? I would say yes and no. It's always been my non-evidence-based view that 85% of women, childbirth is just another normal human function for which we are perfectly designed. For the other 15%, it can be a tsunami for mother and child. And this is very clear when we see how inequity plays out. When such facts such as 1 in 8 women giving birth in Afghanistan die during childbirth compared to 1 in 18,000 in Sweden. In fact, Afghanistan is the most dangerous country in the world for a woman to live in. This is the world in which, as a public health specialist, I'm immersed and where we try to make a difference. But having been schooled by my mother, who had 5 children, who kept telling me throughout my life that childbirth was the most hideously painful, dreadful experience possible, and having witnessed the technological, medical, modern maternity care of induction of labor, etc., and despite being an obstetrician and gynecologist, I ended up with a very jaundiced view about childbirth, and have seen it just as another frontier for war. Until I witnessed the pregnancy and the birth of my most adored sister, all of course performed by a midwife, Marianne Littlejohn. Actually, I discovered in my reading today that the best way to calm a woman in labor is to sit in a dark corner and knit. And that's exactly what I did. I crocheted virtually an entire blanket. Her labor lasted 21 hours. I had complete faith in Marianne, who is sitting in the front row, Marianne Littlejohn, who had to steel her nerves as she conducted the labor with the head of Obstetrics and Gynaecology of Kurtzcare Hospital in the room, and knowing that she had my sister's labor being conducted by a private obstetrician or possibly even another private midwife, she would long ago have had a cesarean section. I trusted her, I trusted my sister, I trusted my sister's soul, her spirit, her courage. I trusted the power of the feminine, I trusted in the divine, and I just knew a beautiful, magnificent angel was about to be born. I cried copious tears, both alone and in Marianne's arms. When Marianne put indigo on my chest and I held her magnificence, my commitment to fight for women, to be allowed access to the knowledge of childbirth, to take back their power without risking their safety, was increased a gazillion-fold. My sister was so totally within the experience of her birthing because of her deep connection to her child, to her body, to all of us around her, and us who trusted her so deeply. The birthing of babies, in my opinion, belongs to the noble and prized profession of midwifery and should be midwife-driven. Doctors have a role to play, but it should be judicious, evidence-based, and centered around the well-being of women and their children, not the doctor. In this world today, where the extractive industries, fracking, oil, coal, etc., have put us all in deep peril, where the patriarchy runs rampant and unchecked, it is only through the rise and the empowerment of the feminine that we have any chance of saving our planet, Mother Earth. As we fight to save the world, let us throw our hearts, our minds, and our souls to the re-feminization of childbirth. Let us give women back their power. Thank you for your attention.